live?
We're live.
All right. Hi, Facebook. My name is Dan. I'm the Director of Marketing and Communications here at Chase Brexton. And tonight we're going to chat with a couple of our providers about COVID-19. So the only ground rule we have is if you have a question, please comment in the comments and we will get to as many questions as we can tonight. So who we have tonight is Maisha Davis, LCSWC, with our social work and outreach team. Dr. Sebastian Ruhs, our interim chief medical director and director of infectious disease medicine. And Randall Leonard, LCSWC, one of our staff therapists here at the LHRC. So with that, we will start the questions. We had a couple of questions beforehand, so I will ask them as we're waiting for other ones to come in. I guess the first question would be for you, Dr. Ruhs. Can someone who's infected spread COVID-19 if they don't have symptoms?
Very good question, and it's one of the questions that is probably it's heavily evaluated. When COVID started to break out in the beginning, because of its similarities as a coronavirus to SARS-1 in 2002, 2003, a lot of comparisons were made, and one of the assumptions that was made is that asymptomatic individuals are not really heavily participating in the community and spreading the disease. And now with more and more countries being affected, more and more people being infected, the available data actually shows something different. While asymptomatic people in 2002 have barely participated, it looks that there's a lot of, well, not a lot, but there's a significant amount of community spread coming from people who don't have symptoms yet, or who go through the corona infection with unnoticeable infections.
Cool, thank you. Our next question comes from Becky, and she asks, once you have COVID, can you get it again?
So another very good question. I think most experts are thinking probably not immediately. From a lot of viral diseases, we know that after having gone through it, the body develops some degree of immunity. For the majority of viral diseases, it's not a full immunity that lasts for a lifetime. For a lot of viral diseases, it's a partial immunity that weans off after a circumscribed period of time. So I think most experts expect that most individuals will be immune for at least 2 or 3 years until they potentially could catch another round of infection. However, there was at least one case that is known to me, reported in Asia of someone who got infected a second time. So there are certainly some individuals where this partial immunity is somewhat on the smaller side. But for the majority of the population, the answer is probably no, not during that round, not during the current round.
Okay. Guys, I'm getting just a message on text that if you could just carry your voices a little bit, because we're trying to practice safe social distancing here with our presenters. So the iPad is far away from them, so let your voices carry. And we're all alone in this room, so you can kind of speak as loudly as you want. This question is for either Maisha or Randall. My kids want to play with their friends. Can they?
So I'll start. So we're recommending, the CDC has recommended small groups, right? Nothing more than 10 people. And if we are really hoping to contain the spread, I think it's going to be important to be real conscious about the groups that we are engaging with, right? Because if someone in your family, right, it continues to work because they're an essential employee, and then they come home and interact with their children, and then those children are interacting with their friends in the community, although I'm not suggesting that, that type of contact is going to create, greater spread, because I don't know for sure, but I do know we want to make sure the reasons why we're social distancing and somewhat sheltering in place to some degree and really trying to not engage in large crowds is because we don't want to create a potential, right, for those disease, for the virus to spread further. So, I mean, I think it's a good idea to encourage some long distance or some distance communication. So maybe not playing, physically in the same yard, for example, but we can, we do a lot of online play, which they do all the time, right? Yeah. We can talk to one another on the internet, so on the phone, engage in games and activities collectively in that way. And we see a lot of that happening now as many of the school programs are transitioning to education and enrichment online. So there's opportunity to stay engaged with friends without, actually physically being together.
Yeah. Randall, did you have something to add?
I was just saying, I've seen a lot of creativity in that aspect, especially with social distancing and implementing that into play.
Yeah.
Because a big part of what we want to do, especially with kids, is that socializing aspect. And this is something that, for a lot of people we haven't seen before. Yeah. So a lot of what I have seen is people implementing like that social distancing into play. And, one of the things that we, like what you had mentioned too, technology is a big thing now. We have FaceTime, we have a lot of online games that are out like right now too. And so, that's basically what you're saying too.
Yeah.
I know I'm learning how to play Mario Kart online, so that's my
Fortnite is the big one. I mean, and Animal Crossing just came out a couple of days ago.
Right.
Yeah.
So there's a lot of,
And they've kind of already been doing that, so that's just another avenue to continue that. I mean, as a parent myself, it's like, okay, we want to limit screen time, in times of where we are, can be an overutilization or overstimulation for kids. So, of course, do so with boundaries, right? With comfortable boundaries that's good for you and your family. But I think now's a good time to also give some freedom, some creativity, and just some opportunity for the kids to stay connected.
Nice. That's a really good point.
Yeah.
That's a really good point.
All right, we have a question coming in on Facebook from Stephanie. Dr. Ruhs, I think this one's going to be for you. Does Chase Brexton offer COVID-19 testing, or can they recommend a neighborhood location to go for testing?
So, very good question. We offer testing. A rapid test was just very recently approved, and my understanding is that it's not available anywhere yet. So a rapid test that will deliver a result in a matter of a couple of minutes will be on the market hopefully within the next couple of weeks. So we do not offer that test. We are we're sending our test samples out. The accuracy of those tests is pretty good because it's an nucleic acid amplification test based. However, the downside is that it takes a couple of days until we're getting those test results back. And so while we're just going into the initial phase of COVID here in the US, there's a lot of things that we learn and a lot of things that need to be built up and be prepared for. The amount of tests that are being sent out to the lab impacts the turnaround time. Because of that, the CDC and most other entities have recommended a screening based testing approach. So patients are being asked why they need to be tested. So it's kind of disease and exposure specific, but then also specific to their risk factors. And so based on that, the clinician or the provider will make the decision if testing is indicated.
Thanks. All right, another question from our pile of questions that we put together before this. And this one is for Randall and Maisha. My parents are old enough to know better, but they keep shopping and running errands and doing needless stuff. They won't ask for help. What do I do?
If there's anything that I have seen, especially being a therapist, behavioral change can sometimes be difficult, especially when you're coming from one aspect and you've been doing this for so long, and now people are starting to ask you to do something completely different. And that's why I like how the stores have implemented certain times for individuals who are at risk to be able to go. Sometimes when we are working with people, it's about acknowledging and validating the experiences that they have as a way of encouraging them to change their behaviors. Because a lot of times if you point out exactly what you think what they're doing is wrong, they're less likely to go ahead and make that change. So oftentimes about validating, hey, we understand where you're at right now, reinforcing that as well, and then gently encouraging alternatives to be able to say like, hey, there's this time and a specific time right now where you can create a little bit of distance, and hey, if you are going to be going to these stores, if you're going to be doing these things, here's what you can do, making sure that you're carrying something to wipe your hands, or making sure that you're not touching your face, which even a couple minutes ago, I was just kind of like, oh wow, you can't really touch your face. So we all have to focus on a lot of changes right now. There's a lot of adjustments that are occurring. Yeah.
So. I really like what Randall said about offering an alternative, right? So behavior change is hard. I can speak from experience. The older we get, the harder it is to do something different, right? And so, so when you say they don't ask for help, they're not. They've been independent much of their lives, right? So instead of asking for help, we offer help. So that's the alternative. Yeah. Here's the help. We have we have better store hours for you. We have specific hours to accommodate you. Hey, I'm going to the store. How about you give me your list, right? Just to put it out there, they're not going to ask for help. So we want them to stay safe. We want to support them. We want to validate their independence and be a resource at the same time. So offer some alternatives. Yeah.
Great. Yeah. All right, another question for Dr. Ruhs. I read about the test that showed that COVID lives for 24 hours on cardboard. I've been getting a lot of packages because I don't want to go out. Is it safe to open cardboard boxes? Those Amazon.
Another good question is because a lot of us are practicing social distancing and partial home isolation. Yeah. I think Amazon and home delivery from a lot of grocery stores are experiencing a new level of a peak. So what is safer, ordering it or going out into the community? So I think the benefit of ordering things is we're avoiding unnecessary contact with other people, and plus if we go out into the community, we're also touching a lot of items that people have touched before. They can start from money or handing over my credit card and getting it back, even though a lot of shops have stopped doing that. But pushing the shopping cart or carrying the shopping bag. So there are a lot of more opportunities for me to touch items that other people have been in contact with before. So but back to the cardboard question. So cardboard per se is completely harmless. However, if someone who is ill and has a viral disease, and it's not just specific to COVID or to SARS, if that person sneezes, coughs in their hand, and then touches that package, there can be potential some viruses sticking on that, and then when I touch that cardboard and carry it inside, then I can have potentially some viruses on my hand. However, the virus on my hand doesn't make me sick. COVID or SARS, the same applies to the flu, cannot penetrate the thick skin on my hands. So it somehow requires that it gets in contact with my mucous membranes, and it can be from me afterwards touching food, bringing it to my mouth, or wiping my mouth, or even touching my eyes. So in order to avoid doing that, after bringing the package in and getting out of the box, whatever it's in there, go to the sink, wash your hands, soap and water for 20 seconds. And that risk is essentially zero.
That's helpful.
We've got another question coming in from Facebook. Both Heather and Stephanie asked this. Anxiety. What tools do you recommend for people to use from home? Maisha,
So, anxiety is a big one. That's the one that we are seeing, both anxiety and depression right now. Understandably so. So anxiety is oftentimes explained as being fear of the future, and at this particular time, the future may seem a little bit unsure. We really don't know where things are going, and so there's going to be some natural anxiety, especially now with a lot of people being isolated at home too. And sometimes when we're isolated at home too, is on the other side of depression, our emotions, which are there really to help us, to protect us, like sadness, for instance, which is uncomfortable, but it's an emotion that we need to have to slow us down a little bit. It can get to a point where if we're either fighting it or if it just continues to grow, it can get into this arena of depression. And so a lot of times people are coming in and saying, like, now that I am at home, what can I do about that? And the first part of it is the whole idea of accepting that there is going to be a little bit of anxiety there. There is going to be a little bit of uncertainty there. One of the things that we recommend too, we live in a world now where we have a lot of information that is just being thrown at you from, on all angles. And our emotions are there because they want to take in that information to allow to understand, like, hey, what is the next step I have to take? And so sometimes it'll be a little bit difficult, it'll be a little bit uncomfortable, but pushing away and kind of disconnecting in certain aspects, knowing which places, that's one of the reasons why I love the fact that we're all sitting here talking, because you can log on to Facebook and be able to see all of us and get some direct information, and at the same time, there's a lot of bad information that's out there too. So when people are coming in and they're asking me about how to deal with anxiety, I know that one of the first things that we say as therapists pretty constantly is, and especially with in concern to COVID, is like taking those moments to breathe, diaphragmatic breathing, taking those moments to just breathe in for a few moments and holding it and releasing, and feeling that natural drop that will occur from that. And oftentimes people will come and say, okay, yep, the therapist is saying to breathe again. And the reason why we say that is because it definitely affects you physiologically. There is a physiological effect with your central nervous system that once you start to do that, anxiety is very much going to focus you on the threat that you are perceiving. And right now, this threat, in certain ways, it can be invisible. There's a lot of invisible threats out here. And we need a way to be able to open our perspective up, to be able to accept that there's a lot of possibilities out there. So we say to breathe, to open up that perspective as that first step to be able to access that hey, okay, this is going on, but at the same time, in this moment, in this present moment, I'm okay, which leads to that next step of present moment awareness. And that's why we say even looking around the room in a moment and just naming things. So instead of jumping into the future, you're now going to be right now and saying, okay, where am I at right now? And that's going to be necessary because in this moment right now, I can breathe, I can think, I can just be where I'm at right now. And one of the other things that we say to kind of practice, especially if meditation is a little bit difficult, is this concept of progressive muscle relaxation, which is really just, it can help you differentiate between tension and relaxed. So if you squeeze like your arms even for like a couple of seconds, and then after you squeeze, you just relax them and just let them kind of just fall, and noticing that big difference there between stressed and relaxed. And just like, they're generally like stretches. You just stretch your arm, your shoulders a little bit, and relax them. And these are those first steps in order to get yourself to a place of relaxation in order to engage in the other coping strategies that you have. Yeah, so, and I've also heard a lot of people saying, now is the time that I'm alone, I'm at home engaging in artwork, engaging in those projects on the side that I haven't been able to do, but I recommend the mindful practice first before that, so you can have the full scope. Yeah. So that was a lot, but this has been something that we have been saying, especially in behavioral health, a lot, so I just wanted to give a full scope out there.
I love it. I think I just add, the only thing I'd add is when we talk about children, I've talked about that a little bit, and their anxieties. I agree, everything that Randall has shared. I think what I encourage parents to do for young people is to really be mindful of the information that they are receiving and the access to the information and the constant flow of information, right? It's a lot for us, fully developed, highly functioning adults, right? So it's going to be a whole lot for young people. And so we want to make sure that they are in the know in an age appropriate way. where they can digest the information and handle it and understand it. And we want to make sure that they are able to disconnect from it as well, right? So we don't want them, watching CNN hours on end, with all of the different stuff coming at them, or better yet, TMZ, gossip shows, or whatever the case might be, because it's an oversaturation of information that their brains aren't quite developed enough to fully parse out what's real, what's not. And so you want to make sure the information that they have is filtered in a way that it can be processed based off of their development. So it's going to be important to make sure, and at the same time, you want to make sure they are getting the information, because just like we are, the information is floating out there and it's in their circles as well, right? So as they're communicating with their friends, everybody's getting all kinds of weird messages, and young people are really quick and really good at taking the message and confusing it and turning it around. And so if we think we're getting that stuff kind of mixed up, you can guarantee that they are too. So it's our responsibility really to help to calm those anxieties by controlling to some degree the access and the information, and then just processing with them in a way that's age appropriate, that makes sense for the 5-year-old versus your 17-year-old.
Yeah.
So,
yeah, that's one of those big things that I know I was hearing from you too, that we practice psychiatric first aid, and a big tenet of that is providing people with information.
Yeah.
Because anxiety is going to be out there looking for information, and when you provide people with information, even if it's good or bad news, at least they have that,
At least they have
can
it.
decide what they want to do with it.
Absolutely. And if you think about kiddos, the younger they are, the more inquisitive they are naturally. That's a normal thing.
Yeah.
And so they're asking the questions, and they want to know, well, what does this mean for grandma? Because grandma's over 60. What does this mean for you? Because you have to go to work. Are you an essential employee? What does that mean for us? Are we going to be able to go to the movies? Or when are we going to be able to, play outside? All the sports events have been canceled, right? What is that for all of their little leagues and activities and school and major events? Graduations and proms and things like that have been canceled. So that's a lot. That's a lot in a little person's world, right? So it's important to really kind of triage through that, I think, and give them the information in a way that they can digest it, and then give them space, right, to just talk about their feelings around it. I think that's going to be key, staying in touch with those feelings, giving them space to express them, to really share what's going on and what does this all feel like. This is a new feeling for all of us, and so you can guarantee if we're struggling, they're struggling, and so we want to pay special attention to how we help them manage through it.
Let me direct a question to both of you. I've received a couple of emails this week from patients of mine saying their level of anxiety went up. What would you give as a recommendation of, hey, okay, this is now beyond the point where home exercises work and where talking to friends work? So are there any kind of warning signs that you would recommend to people out there when they should reach out? And then second part of that question, if someone feels they need professional help, what would be a good way to find that?
Awesome.
Yeah,
Good question.
that is one of the ones, and so the nature of fear, and that's what we were saying, there's going to be a natural amount of fear and a natural amount of just sadness about what's going on right now, which is completely understandable. When we really start to worry is when it starts to grow into that arena of panic, specifically, and it's just, and the more panic an individual get, the more that they're just going to be transfixed on that. And I like, first of all, that people are reaching out to you, because that's like the first step, is really reaching out to the professionals to be able to say or to other people, just to be able to say hey, I'm going through this, because you're not alone. I mean, a lot of us we're all scared, and we all don't have a lot of series of answers. One of the things that I recommend, especially because we need to be careful about suicidal ideation, we need to be careful about impulsivity in a way that is going to cause an individual to engage in behaviors that may not be adaptive for their health. There's a series of hotlines that are out there, especially being a trans and queer individual. The one that I love is the Trevor Hotline, and I wanted to just pass along that information too. Their number is 1-866-488-7386, and that's the Trevor Project. And it's just one of those ones that you can just be able to call up and get information and just be like, talk to somebody in order to take those next steps. And by all means, calling in to either if you have a therapist here or if you have a therapist, we have made we're now doing both telephone sessions and we're looking at doing telehealth as we're moving forward. And there's a couple of other hotlines too that I would like to share, but I want to kind of pass them along my.
Yeah, as Randall is identifying some additional numbers, I have the National Suicide Prevention Hotline here. That's 800-273-8255, right? And this is not saying I am at a place where I am ready to end it all. That is not what the numbers for that, but it's really just to help you process, right, whatever's going on. In the moment you are feeling intense levels of fear, anxiety, hopelessness, worry, and concern, this is a good number to just triage, right, and just to figure out where to go next. If you are dealing with things like, okay, we're all in the house together, lots of stress with being close and on top of one another and dealing with behaviors and your own emotions, it's important to be cognizant of how we continue to take care of each other and not lash out at one another, right? So, particularly if there are some concerns and you need added supports for you as a parent to assure that you are able to continue to take care of your kids, right, without abuse or neglect, or if you have concerns about abuse or neglect for other families, please, there is a Department of Social Services for every state, every jurisdiction in the state of Maryland, every jurisdiction across the nation. And all you have to do is Google that, Child Protective Services, and you can get the number to the location in your jurisdiction and call for assistance.
Yep, which brings up even another one, and it's in line with that too. And a big concern that we have had is in that area, in the arena of intimate partner violence, because now that if a lot of individuals are now more cooped up amongst one another, and there's always been that concern, or there's new growing concerns as well. There are, even though a lot of these places are at, a lot of places are now closing in terms of places that you see out in your neighborhoods, a lot of these shelters are still at play, still in place. So the domestic violence, the national hotline, for 1-800-799-SAFE or 7233 is one to call in order to get immediate help and discuss with that as well. And another one, especially in our area, which is the House of Ruth, which recently I believe that their shelter has been opened up to all genders, which is a huge step and a right step and a great step in the right direction. They still have their 24-hour hotline available too, and that's going to be 410-889-7884. So I know we're giving a lot of resources in terms of phone numbers to be able to reach out and be able to talk to people. But like you said, these are those first steps. So you can call these numbers too if you are, you hear something that's going on, or that you just don't feel that you just want to check in and process with other people too.
Absolutely. I was just going to also add, a lot of practices, a lot of behavioral health, mental health practices are moving to obviously telehealth and telemedicine. And so to identify programs within the state of Maryland that are still operational and are still doing intakes and still have crisis hotlines, go to the state Maryland Department of Health. And there you can access the behavioral health registry basically to see what programs are in our areas, and then you can start and can begin to get some connection that way to identify who has openings. We certainly do, and we're, like as Randall mentioned, we're moving to telephonic as well as telehealth video conferencing for treatment and for care, but so is every other provider in the state. So there's options.
Yeah.
There are options.
So what we'll do is we'll put all of those very valuable resources on our website,
Sure.
www.chasebrexton.org/stayhealthy. So everybody make sure to check out over there and get those resources. Thank you both for sharing all that information. So I have 2 questions in the hopper. The first one I think kind of applies to all 3 of you. So maybe Dr. Ruhs, if you could start off. Are there any special risks or considerations for LGBTQ folks or people living with HIV with COVID-19?
Okay, very good question. Another question that I was asked by quite a few of my patients by email directly during the office visit, panicking through the portal. So I think there's some good information, some reassuring information that we can share here. First, putting someone at risk of exposure, there's certain behaviors that can enhance that, right? Being out and about, having contact with a lot of people, especially close contact, physical contact, sharing emotions like kissing or being sexually active. So I think those are all behaviors that certainly increase the risk, and we might want to cut back as much as possible at this point. So this is, but this is not specifically to any kind of community. Those are general behavioral health recommendations. Specifically for people with certain chronic diseases, talking about HIV infection, there isn't a vast amount of data available on that specifically. However, what we have and what we can see does not show that someone who is positive is at a higher risk of having a more severe course of the infection. There might be a caveat to that. People who have high viral loads are not taking their medication, especially in combination with low CD4 counts, so those might be more at risk. But someone with a normal CD4 count, undetectable viral load, takes their medications daily, there's no data that suggests that specific precautions need to be taken here.
Randall, Maisha, anything to add about LGBTQ folks, people living with HIV and COVID-19?
I'm glad that you brought up that concept of sexual health. I think sexual health is extremely important. One of the things that I have been seeing in community is continued talk about safe sex and what that looks like, especially with this epidemic. This community is very strong. I have also noticed a lot of especially marginalized individuals who have had other socially engineered traumas that are affecting them say like, you know what, this is just one other thing on top of that, and I already have a lot of ability to be able to handle this type of stressors, which can lead into a little bit of a two-way street. On one hand, it can make people say, well, I don't necessarily have to engage as much. And we want to just be sure that we are taking that step back and being as safe as possible. What we have seen specifically, especially up in the LHRC, is a concept especially with trans individuals, and right now this is putting a lot of things, such as surgeries. I've seen a number of both articles and have experienced a number of individuals who have had their surgeries now postponed, which can lead into other types of mental health concerns too. And also access to the pharmacy in order to get hormones, and being able to be able to talk about, with their providers about if, and when I'm going to be able to have access to hormones. And so I think for a lot of our community, this has put many things on hold, but it's also that concept of knowing that on the other side of whatever happens, that we're going to be there in order to assist as a community. And I don't mean just us as Chase Brexton, but this entire community, which has worked through so many things over the course of all these years in order to advocate for ourselves to get a lot of these back on track. So I have been, encouraging, especially if there's a situation where the surgery has been postponed, or you have been furloughed, or right now things are just on hold, to just take again a look at what coping strategies have worked in the past and just go ahead, and I know we keep hearing this phrase over and over again, shelter in place, but to just go ahead and just hold for right now, continue to talk to people, and we will push to get those postponements put back into place on the other side of this. So I think it's really important, especially that, you know, we need to share voices out there for the trans community, specifically that there is a lot going on right now that's that a lot of things that are put on hold. We see you, we hear you, and we're going to continue to fight for, you know, what we need.
Yeah.
Great points.
Yeah, that's excellent. I would just add that our Ryan White partners at the state as well as the local health department level have been publishing and sharing with us resources specific to our patients who are living with HIV. And so I'll make sure you get those resources to go onto our website.
Awesome.
Yeah.
Thanks. All right. The other question that we got in on Facebook, and Facebook land, please feel free, keep sharing, asking questions. So we have about, let's see, another 20 minutes, and we have tons of questions, but already prepared. But if there's anything you want specifically to ask, now is the time. One question we have from Stephanie, and this is for Dr. Ruhs. Does Chase Brexton support teletherapy services? I guess this is for all of you. If so, how can this be set up? Thanks.
So this probably goes more into therapy land.
Yeah.
But I can answer generally telehealth services. So as we are promoting and supporting all kinds of social distancing, and that means for us specifically minimizing face-to-face contacts, we're looking into what kind of appointment visits can be rescheduled into a non-traditional form of an appointment. And this means mainly telehealth visits. So as this pandemic wasn't rolled out over the last couple of years, it came rather abrupt. We didn't have much time to prepare for this. Our excellent IT team has been working on multiple different options, and we're coming close to the point where we can implement telehealth for all of our departments and for most of our services. So as soon as that is rolled out, we'll certainly heavily advertise that. People who have scheduled appointments, they can expect to receive a phone call from their provider or from their provider team, reaching out to them, asking if they are interested in converting a visit into a telehealth visit. So there's a lot to come.
I'm particularly excited for this because human beings, we are social creatures. We are social beings. And I know that the type of therapy that I practice in particular, I practice acceptance and commitment therapy, and I also practice emotion-focused therapy. And both of these, to a degree, need to have like that face-to-face interaction. I do a lot of body language scanning. I do a lot of reflection on like, hey, like the way that, you know, we're sitting right now, like, you know, there's a lot that is lost oftentimes over, you know, just doing telephone. Now, telephone is, of course, you know, the whole idea is to be able to talk directly to somebody and get that information and provide information, much like what we were talking about in the arena of psychiatric first aid. But there's just a lot, especially with where things are going, to be able to have like that face-to-face interaction. And the one thing that we do have now in 2020 versus past pandemic situations is access to technology where we can make that happen. We can now say, like, you know what, as long as you have this type of technology, that you can now speak directly to a provider. But I also want to point out that, you know, that comes with a level of privilege, of course, with having access to technology.
Yeah.
And so we're also going to be, you know, looking at, maintaining both telephone conversations and other ways of being able to, you know, be able to access. But I'm really excited for telehealth. And I'm glad that Chase Brexton is allowing their providers another tool to be able to assist our patients.
And from our perspective, from the social work and outreach team, we are continuing social work and outreach to our patients, really with the idea of keeping them informed, right? Supporting them with the resources that we're aware of, and really helping to kind of, calm some of those anxieties as it relates to those psychosocial needs. what's really good that during this time, things like you don't have to stress yourself and worry about evictions. That's not going to happen, right? BGE has committed to not turning off utilities. All of the utility companies are not disconnecting service, right, during this time. And so those little things can be really big things that, our patients struggle with on an ongoing basis. And if they are actively trying to stay healthy and focus on keeping their loved ones healthy, we don't want those things to be a worry for them. So we are continuing to outreach folks by phone, making ourselves available to answer questions and provide that support in other ways so that they can rest assured that their psychosocial needs can continue to be addressed, as well as their medical health and behavioral health needs.
So I'm sorry.
Oh, no, I was just gonna say, that gets back into like the power of this community too. One of the things that I love to say, especially when I'm in session, is that there's multiple experts in a room. I'm not the only expert. These individuals, they know their lives. They are an expert. And so this beautiful community is, even in the scope of all of this difficulty, they're looking at ways to be able to advocate for themselves. It's very nice to be able to come to the social work department and just be like, what access or what points do I have and what resources do I have? And also a lot of community members are out there rethinking that scope and saying, what can we do in order to induce change in our community right now and utilize this as a way of being able to have further access. But I also want to point out that this is probably a good time too to mention the Maryland Medicaid and the MCOs that have opened up, because that was a big part too of just like when you're on a specific MCO, now you have that ability to be able to
we can definitely do enrollments now. It's been extended. The open enrollment period for insurance and for Medicaid qualified health plans has been extended federally through April 15th. And so through Maryland Health Connections, we are able to do enrollments on the phone now, and so that's exciting. It's going to be very helpful, so you don't have to worry about trying to gather all your paperwork and then come down to an office and then wait for service. There are opportunities to get access and get enrolled with online or via phone without having to see someone in person. So just to note, MarylandHealthConnection.gov is where you want to go for the website. There's also an app, Enroll MHC app. Go to your Google store or your Apple store, I think, too, and you're able to download the app. And then the number is to call and get assistance is 855-672. For our Chase Brexton patients, just give us a call, and we will be able to support you through navigating through that to make sure you're covered. But in addition to that, the good part is that if you were due to expire soon, coverages have been extended through April. If you have MADAP, that has been extended, that prescription assistance program. And so everything has been kind of really put into place statewide for our patients, for the community, to not have to worry about access, so they can still get in, be seen, get what they need without having to worry about, not being able to pay or not having access. So thank you for remembering to bring that up.
All right, so for telehealth at Chase Brexton, stay tuned, keep up with the website and on our Facebook, Twitter, Instagram, et cetera, and as well as open enrollment, we'll post some information as well. Let's see, going to my list of questions here. Dr. Ruhs, how long is recovery from COVID-19 and can you get reinfected?
Recovery, I don't know that anyone has a good answer to that. We're still learning a lot about this particular infection with the coronavirus, and we have learned that different than with the SARS epidemic in 2002, 2003, that there are a lot more cases this time around that are either asymptomatic or only mildly symptomatic. And so to kind of like get a good idea of what is the typical length of the disease picture, I think we're still a couple of weeks or months away from having that data available. there are currently some ideas and some recommendations coming from the CDC of when is someone considered not contagious anymore and can return back to work or can return back into their communities. The current idea is that at least 7 days after onset of symptoms and at least 72 hours of being afebrile and having experienced significant improvement of respiratory symptoms. So that is kind of the idea of after what period of time someone is considered non-contagious.
And can I ask, just so we can, just as we're all discussing amongst us as providers, sometimes it's really important to have like just a basic understanding. Can I ask, what are the symptoms? I know we have all talked about it, but I think it would be really important, at least for Facebook land. What are the symptoms that we're looking at in order to be concerned, or that we may need to be tested?
So a very good question. It's a viral infection, so there are these non-specific viral symptoms: feeling fatigued, having a little bit of a headache, having muscle aches, not feeling 100%, and then there's a little bit more specific component of this coronavirus that it affects the lower respiratory tract. So having a dry cough that usually gets worse over the course of a couple of days, and for people who get severely sick, usually takes about a week plus minus a couple of days until they have really achieved the peak or the worst day of their sickness. So bottom line is, it's very difficult to guide someone on those symptoms. If someone comes in with a very typical and rather severe disease picture, it's certainly easy to give that a name. Someone with a milder course, it can be a lot harder. There are a lot of seasonal viruses around at this time of the year, so that makes it a little bit more complicated. What is less typical for COVID is these upper respiratory symptoms. I'm not saying that doesn't exist or it doesn't occur, but starting off with sinus pressure, sinus infection, and a runny nose, and then slowly making its way down, it's certainly a little bit less typical and makes it less likely that we're dealing with COVID-19. And another thing is also the kind of cough. It's typical to have a dry and non-productive cough. Someone comes here with a lot of thick sputum that they're coughing up, probably not COVID.
Okay, so the dry.
It's typical is the dry cough.
Okay. And that's one of the things that we've been seeing too, is complications from COVID. So that concept of complications. These are just questions that I've been asked by my patients, and so I figured just to get them out there too.
Right. Yeah. So what could be the worst course of COVID-19 is kind of like what I'm hearing is what you're asking. So if someone progresses into a more severe disease stage, it's typically pictured as a pneumonia. So inflammation or infection of both lungs. And what happens during a bout of pneumonia, especially in these cases, there's fluid that accumulates in the interstitial into the interstitial lung spaces, and so there is from the blood vessels that transport the blood and the lung, there is a thin layer of tissue through which the oxygen has to transfuse through. The oxygen gets into the blood and then supplies oxygen to the whole body. The thicker this layer gets, the more difficult it becomes for the oxygen to get from the lung spaces into the blood. So the more water that accumulates there, the more complicated it becomes. And eventually, some people they will require oxygen or even machines to help them breathe. So, and that also explains why certain groups of people are at a higher risk of having more severe complications. So people with underlying lung disease, smokers with heavy COPD or emphysema, who already have an issue of getting the oxygen from the one side into the bloodstream. It's relatively easy to understand that it doesn't require a whole lot to make this a more severe disease picture. So people with poor heart function, right, requires a lot of strength from the heart to pump that blood through the lungs. If there's now more pressure as a force coming against the heart, it's easy to understand of why people with impaired heart function can become decompensated and require admission to the hospital.
Yeah. Thank you for that. I know this is even in listening to you, and this is one of the things I'm saying, we're all human here, and even listening to you, I get a little bit of that anxiety, and at the same time, I think it's really important that, again, just like what we were saying earlier, provide information and allow people to take that information and do what they, they can with it. So I appreciate giving out full, because oftentimes a lot of these outlets, they use those code words, and people still have questions as to understanding. So I appreciate you taking the time to be able to share.
Yeah, there's actually another thing that we can share is what can people do to be more proactive, to avoid to go into such a severe stage in case getting infected. And I think smoking is one of the big things. So I would encourage everyone who smokes to try to cut back and even stop. I know this is extremely difficult, especially during a time period when we're dealing with anxiety. A lot of people use smoking to cope with anxiety. But it is definitely helpful to cut back and even stop and quit smoking. It decreases the risk for a severe course.
Yes.
Kind of piggybacking off of that idea of sort of understanding a lot of this information that's out in the universe, and some of it seems, I think, abstract to people. One of the questions we had was, what exactly is shortness of breath or difficulty breathing? Like, how does one kind of self-assess that?
Yeah. So I think there's the physiological component to it, then there's a psychological component to it. So shortness of breath is very non-specific. There's a lot of things that can cause shortness of breath. So when I'm stressed out, I'm short of breath. When I come back from my run, which I don't do frequently enough, but when I come back from my run, I'm short of breath. So I think these are kind of more physiological reasons to be short of breath. However, when I'm getting sick, and I have trouble breathing, or I'm coughing very frequently, then we're getting more into kind of like the pathological reasons of why someone can be short of breath. And again, my little membrane, oxygen from the one side needs to get into the blood. If that is impaired because I'm breathing too heavy, because that membrane gets thicker and thicker, or because I have an asthma exacerbation and my airways get tighter and tighter, it makes it more difficult for air to get in and out. So all of these can be reasons for people to be short of breath. So I think the key point here, the important thing is, if someone really feels they get short of breath, they should be assessed, especially if it's in combination with having a cough and having a fever and feeling malaise, feeling sick. So this could be a viral infection. If someone feels short of breath without having any of these classic sick symptoms, it's extremely unlikely that they'll have pneumonia from COVID-19. Pneumonia really means full-blown infection of the lungs, and that does not occur without feeling fatigue, having muscle aches, having a headache, and having a fever. So if someone only experiences shortness of breath, should maybe look into other reasons that can cause that as well, such as anxiety or feeling stressed out at home with the current situation.
Yeah. I love the fact that you pointed that out, and that gets back into my concern, at least with anxiety, and especially if it goes to panic, because what we know with panic attacks is that you can just have those really quick breathing. And the thing about that is that anxiety and panic are also very narrow. They want to focus on, or reinforce that fear. And so now it can just turn into, okay, I can't breathe now, so that clearly must mean that I must have, X, Y, Z, and then your brain is really starting to travel further with that. And so that brings it back to, we therapists are always talking about breathing, and especially right now with the nature of COVID, sometimes it literally is just about saying, hey, you know what, I'm gonna have to just go ahead and take that full breath in. If aren't those other underlying symptoms, if we think that it is anxiety, if we think that it is panic, sometimes it literally is just about slowing things down. Sure. Time can be very relative in terms of anxiety and panic, and just taking that little bit of that moment to just slow things down, doing those stretches that I was even describing earlier. There is many different reasons why that quote-unquote shortness of breath can come up. Panic can definitely cause that.
So we're close to the top of the hour, but I have two more questions.
This is fun, right?
I know, right? Before we started this, everybody was like, I don't know how we're gonna do it for an hour, and then it's like, oh wow, we're ready to y'all can talk, which is great. Better you than me. So this is a question from the live. Hey, Dr. Ruhs. This is for you, Dr. Ruhs. I have diabetes. My sweetheart has asthma, but we are both in our 40s. pretty healthy and well controlled with medication. Can you tell us about the high risk groups and what makes the risk?
Yeah. So very good question, and that's a little fluent, and I want to really pronounce here. A lot of people are panicking because they see themselves listed in a certain risk group. I have asthma, and underlying pulmonary diseases are listed as being a risk factor. So asthma does not equal asthma. If someone has exercise-induced asthma and takes their albuterol pump 1 or 2 or 3 times a month, they're certainly not as a tremendously high risk. Whereas someone who is on 2 inhaler and oral medications to keep their asthma controlled and had multiple hospital admissions before, so that is I think is a little bit of a different story. And so people who have more complicated courses of airway disease in the past, they want to make sure should check in with their primary care physician or with their pulmonologist to make sure that their therapy is really maximized at this point to minimize the risk. Another example that just came up in the question is diabetes. Diabetes is not diabetes. Someone with a mildly elevated sugar level, which is diet controlled and does not require any medication, whether that risk is even increased, it's very questionable. However, if someone has a skyrocket high sugar level, is on insulin and 2 other medications, that again is a different story. Having high sugar level is not good for the immune system, and is not a good predictor for outcome. So someone with poorly controlled diabetes, I would encourage that everything they can do at this point, with nutrition, with medications, get your sugar levels under control to minimize the risk. There's a lot that can be done in the short term. Cut out sweet drinks, eat more healthy, more greens, more vegetables, and make sure medications are being taken regularly as prescribed by the doctor.
So I lied. Oh, I'm sorry, Randall, go ahead.
I also always like to point out, especially because we do live in Baltimore, that concept of eating healthy can mean many different things, especially with some of the fruit deserts around in the area too. So yeah, I think that brings it back to really working with the social work department and a lot of these community advocacy points. There's been a lot of vegan interest, and especially Black veganism, which I love in this city. To be able to, I think a big part of this is that socio-education to check in, especially if you have those times right now, to check in with social advocacy that's happening in your area, to be able to utilize this once again, to bring more resources into this community. Yeah. So I just want to say that because I as a social worker, I hear sometimes people say these things, and it's also important to be able to focus on pushing more resources into our community too, and we can all do that. We can all do that.
That's really valuable info. So I'm a liar. I said 2 questions, but now I have 2 questions, and then we're gonna cap it off. We might have to do this again. I feel like it was really valuable, and there was a lot of valuable information. So one thing I wanted to ask you, Dr. Ruhs, was that there was a lot of people on Facebook land and Twitter land and Instagram are talking a lot about flattening the curve. So what exactly does that mean? And I am kind of asking it for myself just because I see this beautiful illustration that you very carefully and thoughtfully made. So
yeah, we don't
do a little demonstration.
We don't want to leave this clipboard unused. So flattening of the curve is one of the buzzwords that has been used in a lot of news reports, and often in these short clips without a lot of explanation. And I've been asked multiple times what exactly that means. So generally spoken, not specific to the current situation, generally spoken, we have the x-axis with which is the time that goes by, and then the y, that is the severity of the cases that we're seeing, or the amount of cases that we're seeing. So with any kind of outbreak, whatever it may be, measles, Ebola, flu, or COVID-19. So we see this slow increase in cases, and then all of a sudden this exponential pickup of cases with a big peak, and then after the peak we see a pretty rapid decrease, and then a somewhat longish tail. So With the flu, we see this pretty much every year. We see a peak. We see a peak in our communities, usually lasts 2 to 3 months, and then the flu goes away again, and there's not much that needs to be done. However, with things like COVID, we're worried that more people can get infected than with the flu, and then also more people might experience more severe courses than with the flu. And such a peak, the problem with that would be that it can overwhelm the healthcare system. At some point on this peak, there is a line here of how many cases a hospital can take until the hospital is simply filled up. And everything above that in a hospital that operates at capacity or even beyond capacity has a poorer chance of a good outcome, simply because the resources that are needed in that hospital are not available anymore. And so this is what we're talking about with COVID-19. We're trying to flatten the curve so that our healthcare system is able to absorb the amount of people that might become more severely ill and require more attention. And so what the flattening of the curve does is, so it decreases the amount of cases per time, and it also pushes the peak out. So that has multiple benefits. The first one is, as I said, we have more resources in the hospital. It also buys us more time to implement other ideas of how we can push this curve further out, but also more time to develop measurements that might end this peak, and such as vaccines or new medications for treatment of the disease.
Thank you. That will be photocopying that and putting that on the website as well. Thank you for that beautiful illustration. So I guess to close, I wanted to ask each of you if you could just maybe share a tip or two about ways that folks who have a lot of anxiety, that may be in isolation, that don't really know what's going on, like ways for them to kind of keep, for lack of a better term, I guess, sane. So sane and healthy. Maisha, if you want to start.
Sure. So I think even in our isolation, our human connection is really what always pulls us through whatever we're going through. And so find ways to stay connected, whether it's within your own home, within your own family units, even if it's with your neighbors across the fence. You know, that you have to figure out a way to stay connected, to stay informed with accurate, factual data and information from reliable sources. Filter it. Be sure to not oversaturate yourself with the information. And then do things in your isolation or your downtime that are rejuvenating for you, that are inspiring to you, whether it's reading a book, watching a favorite movie, listening to really great music, praying, talking to others, whatever that thing is, hobby, dancing in your living room. I don't know if you guys have experienced, there are lots of house parties, virtual house parties happening. That has been awesome because you get a lot of throwback music, and you know, we all know the healing effects of music. So, you know, whatever that thing is, make sure you find a thing, right? To stay connected, a way to stay connected, stay informed, and just to release that energy, to keep yourself inspired and in the game. So.
Dr. Ruhs, tips to stay healthy?
So to make this a little bit more medical focused, I think the most important thing you already said, don't panic. Don't get overwhelmed with information that is not filtered, and I don't want to say is a lie, but contains a lot of half-truths, because that certainly is a stimulus for panic. But for people with medical conditions specifically, as I've already pointed out, make sure the chronic conditions are well controlled. And I would also recommend to not operate on an empty pill bottle. You know, refill medications as soon as possible. Most insurance companies allow a 4 or 5 day early refill. So try to get your refills early. Have a little bit of a stock at home. We're not currently in any kind of situations where the supply chain is short, and at least not to my knowledge. And I've seen these messages out there, so I also want to reassure everyone we're not there. But just preparing ourselves that next week or the week after might be a little bit tougher than this time. So make sure you have enough medications at home.
Randall, same question. Healthy and well tips.
Humans are beautifully creative individuals. And if there's one thing that I have seen, this is a perfect time to really get into how oftentimes we have been socialized to think that showing emotion or having emotion is a weakness. And that's an unfair, that is just completely unfair, because we need our emotions. There's a reason why we have emotions. Emotions are there to protect us. We have our intellect, we have our prefrontal cortex, which is just amazing at figuring out answers. But we also have this wonderful place of emotions that's there to either protect us, or also they show us different perspectives, they assist us with reframing, and they also regulate a lot of our energy. And so now is the time to really allow yourself to just be within the scope of your emotions. If you feel sad and you just want to cry because of what's going on right now, allow yourself to do that in a safe place. If you feel a little bit angry, and this is one of the things, a lot of art is created from a place of anger. There is nothing wrong with anger. Anger is an emotion, it's completely okay. It is what we do with that anger, that's when it starts to get to a certain place of, okay, all right, don't go out and do something dangerous with that anger. Transform it into something that is creative. And one of the things that I pretty constantly see these days too is that it's difficult. Sometimes people have a lot of difficulty finding joy. And I think for the most part, you don't really, one of the reasons why is because you don't have to protect yourself, generally speaking, from joy. You have to protect yourself from things that you're afraid of. If a lion is chasing you, you got fear there, or you have to anger as a way of going out against something that's threatening you. You don't have to protect yourself from the fact that you enjoy the way a song sounds, or that you enjoy the way something tastes. Yes. And so oftentimes people are like, well, I'm not allowed to, I've heard this, like, I'm not allowed to be joyful right now because of all the things that's going on. But the truth behind the matter is that we need that joy in order to counterbalance the sadness, in order to counterbalance the fear. And so I know certain times people do not like the phrase the silver lining, but oftentimes, especially right now, and if there's anything that you can do to remain, safe and healthy, it is perfectly okay to find that silver lining and compare it to that other side, so you can balance out the full message that's going through your mind in order to get a full scope. So allow your emotions to just be, because the major concern is, especially like with sadness, is that if you fight it, if you don't allow it to happen, it will continue to grow to a point where it will become depression because it's trying to slow you down. And that can just lead into, even further thoughts. So I just love the fact that, again, I see so many people who are just like, I got so angry that I just went in there and I haven't drawn in so long, and I just angry, and it's just, that was peace. Now I can hold my anger in my hands right now. And so it touches back really into what both of you were saying too. Stay healthy within the scope of the house in order to turn it back to that medical aspect, but also using that creativity and going with the coping and angry dancing, or just doing whatever it takes and allowing these emotions to exist.
Well, that's a beautiful way to end this. So our hour is up. Randall, Dr. Ruhs, Maisha, thank you so much for hanging out with us.
And thank everybody out there.
Yes, and thank you, Facebook Land. And keep the questions coming. Keep visiting our website, chasebrexton.org/stay healthy. Follow us on Facebook, Twitter, Instagram, all the other places where we are. And we'll see you soon. Thanks. Bye.
Bye-bye.